Hello, Biology 213 students, and welcome to part 2 of this course online. So I'm going to be posting weekly recordings of my lectures. There'll be at least 2 per week, maybe more. And these will be short, no longer than 15-minute lectures. So as always, I encourage you to be reading your book as we're going through the material and only using these mini lectures as a supplementary resource. So I know we still haven't had our second lecture test on the circulatory system, including the immune system. That will be given next week. So this week we will start the respiratory system, although it won't be on your second test. So here are the structures. That's what we're going to focus on in this lecture, the structures. So here it is, the respiratory system. It includes your nasal cavity, followed by the pharynx, the throat region. After that comes your larynx, commonly called the voice box, your trachea, commonly called the windpipe, and then notice how it splits in two here, forming your right and left primary bronchus, or bronchi for plural, and those break up in the lungs into smaller and smaller branches, which you can see in this picture. They call it the bronchial tree because it looks like a tree. And the branches are systematically named primary bronchi, secondary bronchi, tertiary bronchi, and it keeps getting smaller and smaller until you get into the little bronchioles. Don't worry about all the different kinds of bronchioles, terminal and respiratory, but I do want you to know that the small branches are called bronchioles, and they lead into the very, very end of your respiratory tract, which you cannot see in this picture. They're microscopic, but they look like little bubbles. They're called the alveoli, and that's where the air ends. So we'll be looking at that in a later lecture. In addition to the bronchial tree, there will be a lot of blood vessels in your lungs, and then the connective tissue in between, like this orange tissue in between, is has a lot of elastic fibers in it. It's an elastic connective tissue. Your lungs need to have a lot of elasticity to them. So that is your respiratory system. Here's a cadaver view of it. It shows them lateral to your heart in the middle. This is in your thoracic cavity. Now the main function of your respiratory system is for gas exchange. We have to take in oxygen. Why do we need oxygen? This is something that's going to be on your objective sheet for Unit 3. We need oxygen, recall, for cellular respiration in order to oxidize food, in order to make ATP. And in the process, CO2 is a waste product generated that we need to eliminate. And while most waste products are eliminated through feces or urine, CO2 is eliminated in the respiratory tract through exhalation. Another function helping to regulate hydrogen ion concentration in the blood, or blood pH. We actually talk about that in Unit 4, so that'll be in a much later lecture. We'll come back to that. And then other functions include olfaction, because as you recall from 212, your olfactory receptors are in your nasal cavity, responding with nerve impulses to odorous molecules that pass through. Also, we filter the air that we breathe in, remove impurities, pollen, dust, microorganisms, and our larynx or voice box produces sounds. So those are all additional functions of the respiratory system. So for the rest of this lecture, we're just going to go section by section, starting with the nose, and look basically at their structure and talk a little bit about function. So here we see the nose externally. It's made of quite a few different tissues. The nasal bones form the bridge of your nose, and then blue we have cartilage, and then dense connective tissue on the sides here of the nose. And then if you look inside, you see that your nasal cavity is subdivided by these bumpy bones that stick into it. Again, hearkening back to 212. Remember the superior, middle, and inferior nasal concha? Those bones that project into the nose with furrows in between or grooves called superior, middle, and inferior meatuses. So the function of all of this, oh, and by the way, it's covered with a mucous membrane. And the function of all of this is to increase air turbulence. As the air goes through your nose, these little grooves make it swirl around more and take longer to get through and give the mucus more time to filter the air. So that is a big function of your nose, is to filter the air. You also humidify it and warm it. So that is a specialty of the nasal cavity. You can also breathe in through your mouth, but it's not equipped for filtering the air like your nasal cavity is. So after, and in the nasal cavity, there's so much mucus required to filter it that you also need your paranasal sinuses, shown here, that are cavities inside your frontal, maxillary, sphenoid, and ethmoid bones. They all have lined with mucous membrane with ducts that carry mucus into your nose. So in addition to your nose making mucus, so do your paranasal sinuses. So here it is spelled out. The nose filters, warms, and moistens the air, and also detects smell. And here we see a reminder from 212 where those olfactory receptors are. They're in the roof of your nasal cavity, in the so-called olfactory epithelium. Here they are in blue. These neurons respond to odorous molecules with action potentials, with nerve impulses. After the nasal cavity comes your pharynx, which is divided into 3 sections. Naso, behind your nose, that's really only for air. Food and liquid are not supposed to go up there. Oro, behind your oral cavity, shared with the digestive system, as is the laryngopharynx. So naso, oro, and laryngopharynx. Those are the 3 segments. That's the kind of thing I'll ask you on a lab practical. Functionally, it's basically a conduit for air moving down into the lungs. It does have the auditory tube opening up into it to equalize air pressure across your eardrum. It has the pharyngeal tonsil to help guard the body from pathogens entering through your nose. When you get to the end of the pharynx, notice there's a divide. If you go anteriorly, you go into the larynx. That's the way air needs to go. If you go behind it, that's where food and liquid needs to go, into your esophagus, which goes on down into your stomach. So you need a way to make sure things go the right way there. That's what the epiglottis is for. It's a piece of cartilage that's part of the larynx, and every time you swallow, it just automatically closes off the opening into your larynx, this opening right here called the glottis. So the epiglottis sits above the glottis and closes it off every time you swallow, whether it's food or drink. On the other end, going back up here, this little flappy muscular end of your heart, the end of your hard palate, they call it soft palate. This dangly part called the uvula closes off your nasopharynx every time you swallow. So that keeps food and liquids from going up and out your nose, which, if you've ever had that happen, is not fun. This shows the larynx. Here's an anterior and a posterior view. There's that epiglottis we were talking about. The larynx is made of 9 pieces of cartilage. For example, this is called the thyroid cartilage because your thyroid gland's nearby. This is the cricoid. And there's some others in the back. You'll be learning those in lab. Those are lab questions. On the sagittal section, you see these connect tissue bands stretched across the glottis. These here are your vocal cords that vibrate to produce sounds. So the thicker they are, the lower your voice. So men tend to have thicker vocal cords, hence lower voices. And depending on how you vibrate them, you can make high sounds and low sounds, depending on the frequency that they're vibrated. So sound production is a function of the larynx. Here you see the vocal cords with the glottis open. Here they are closed. After the larynx comes the trachea, which then again divides into the bronchial tree. Now let's talk about histology for a moment. I do ask you about the histology of the trachea and the bronchial tree, and my suggestion is that you learn it in the following way. First, learn the trachea. It is a organ that is lined with a pseudostratified columnar epithelium with cilia to move the mucus. Under it is a basement membrane and then some connective tissue. And here you see it better. This is actually the slide used in 212 for pseudostratified columnar epithelium. And then if you look way down, this is not a great slide, but here down here is a cartilage. These are those cartilage rings that keep your trachea open. Okay, so once you learn the trachea, know that your larger bronchial tree branches, like the primary and secondary bronchi, are similar to the trachea, but as you get into the little smaller bronchioles, here's what happens. The epithelium changes from pseudostratified to simple columnar. You stop making mucus. It's just too far to move the mucus up away from your lungs to your throat where you can swallow it and get rid of it in your feces. That's what we do with it. Instead, we use macrophages that creep around down there and phagocytize things. The cartilage rings become less and less until finally they disappear, and in its place there's more smooth muscle, and you can actually constrict and dilate your bronchioles. So that's the bronchial tree. It's carrying air down to the lungs, and then in this picture, the main thing I wanted to show you here was this cavity out here. This cavity is called the pleural cavity, and it's a space between the serous membranes that cover your lungs and line the thoracic cavity. Those are called the visceral and the parietal pleura, and in between is pleural fluid, serous fluid for lubrication. No air is in there. If air does get in there, the lung on this side will collapse. It's called a pneumothorax. We'll talk more about that later. So I think I'll stop here for now. So we've gone through the basic structures and functions and a little bit of histology for the respiratory system. Next time we'll talk about physiology, how we ventilate our lungs, and about gas exchange. So let me know if you have any questions.